Massachusetts hospitals secure lifeline as Trump-era cuts loom. But is it enough? September 25, 2025 at 2 p.m. UTC. In a move that's both a sigh of relief and a call to action, Massachusetts hospitals are set to receive a $234 million state funding package just as they face mounting financial pressures exacerbated by federal cutbacks under the Trump administration. But here's where it gets controversial. While this funding is a critical lifeline, it raises questions about the long-term sustainability of healthcare systems in the face of ongoing political and economic challenges. Governor Maura Healey signed the bill earlier this week, allocating $122 million to acute care hospitals and $77 million to the Health Safety Net Trust Fund. This fund plays a pivotal role by reimbursing hospitals and community health centers for services provided to uninsured and underinsured residents, a population that's grown in recent years. Additionally, community health centers will receive $35 million to bolster their operations. Among the beneficiaries are some of the state's largest healthcare providers, including UMass Memorial Medical Center and Tufts Medical Center, both of which have been on the front lines of addressing the state's healthcare needs. And this is the part most people miss. While the funding is a welcome relief, it's a temporary solution to a much larger problem. The Trump administration's cuts have left hospitals across the nation scrambling to maintain services, and Massachusetts is no exception. The state's proactive approach is commendable, but it begs the question, how long can state-level interventions sustain a system under federal strain? Is this a band-aid on a bullet wound, or a step toward a more comprehensive solution? For beginners, it's important to understand that the Health Safety Net Trust Fund is essentially a safety net for the safety net. It ensures that hospitals and community health centers can continue to serve those who need it most without facing financial. Is Massachusetts setting a precedent for other states to follow? Or is this a temporary fix that avoids addressing the root of the problem? As we navigate this complex landscape, one thing is clear. The future of healthcare in Massachusetts and beyond hangs in the balance. Will this funding be enough to weather the storm? Or are we merely delaying the inevitable? Share your thoughts in the comments. Let's spark a conversation that could shape the future of healthcare.